Carolina. I'll start with a few intro and then we'll go right ahead. Yeah, okay. Thank you so much. Hi, Carolina and dear colleagues who are with us today. It is my huge pleasure to introduce my long, was it friends and colleague have been working together for a few years on smart estimation. Carolina Franco. She's the principal statistician at NORC at the University of Chicago. So a lot of experience in survey research and very, very well recognized in the area of smart estimation. At NORC, at University of Chicago, she has worked on methodology for producing smart estimates of hearing loss for countries in the US, and also on smart estimates of entrepreneurship type by geography, race, and gender at the MSA and state level. Before that, Carolina worked with U.S. Census Bureau on Centers for Statistical Research and Methodology, that where she last served as principal researcher and group leader of the SAE group within this center of for statistical research and methodology, and the very famous SAPE program on poverty estimates using smart estimation method. And she has worked a lot on that. So today, it's a huge pleasure to have Carolina for a presentation on the recent work of her and her colleagues on statistical data integration for health policy evidence building. I'll let Carolina do all the introductions. So before that, quickly, my name is Howie Chen. I work at UN Statistics Division. I'm a coordinator for the Intersecretary Working Group on Household Surveys. It's a group that consists of 11 international agencies and 10 member states. Our mission is to really advance survey methodology, innovation, bring in information, and work together, foster partnership, collaboration, and also really emphasizing with everyone that still the importance of a household survey. You will see it today, right, Carolina? That household survey is going to be part of this data integration. I'm also leading the work on data integration within UNSD. So this is really under, we have a work program on data integration within UNSD. And a couple of years ago, when our group, the Intersecretary Working Group on Household Surveys, worked on a paper called Positioning Household Survey for the Next Decade. It was really out of frustration and the really urgent support needed by countries on for their household surveys during COVID. And over there, we identified 8 priority areas, eight technical priority areas, and the number one that is on data integration. So we really understand the challenges, data challenges, and we understand that survey only would not work for all the challenges we need to meet and overcome. And that's why we're here today. Without further ado, and over to you, Carolina, please. We've muted all of you. We will open the mic once Carolina's presentation is after her presentation. If you have any questions, and put on the chats or Q&A sessions. There's a Q&A button, and we will open the mic afterwards, after the presentation. Over to you, Carolina. Thank you. Thank you.
Okay, well, thank you so much, Howie, for the nice introduction and for the invitation to be here. I'm looking forward to chatting about data integration for health policy evidence building. So actually, the majority of this talk is based on a forthcoming paper with my colleagues at NORC. In fact, this paper, it will come out in 2025 officially, but the early online access is already available. And this was a very nice collaboration with, so Susan Paddock has decades of experience in health and policy statistics. Jay is an expert on combining probability and non-probability samples among various other topics in the analysis of complex survey data. And Brenda specializes on methods like record linkage, data merging, and deduplication. And And as Howie mentioned, my area of specialty is primarily smaller estimation. Of course, I work in other areas as well. So this was a really interesting collaboration to be able, and so we were able to discuss different aspects of data integration. So I encourage you to check out our paper. So brief overview of what we'll discuss. We'll give some motivation. We're going to talk about data quality. We're going to talk about blending probability and non-probability samples. We're going to talk about smaller estimation. We're going to talk about expanding the number of variables in the data set. And then we're going to give some conclusions. So what is data integration? So data integration involves combining disparate data to create a source that is richer and more informative than any one component. So for instance, you may want to combine surveys, electronic health records, registries or administrative records, census, and non-probability samples. And as Howie said, surveys are still extremely important when combining data. So our paper kind of is grounded in surveys. When we say richer and more informative, we mean for the purpose of the study in question. So it's important to keep in mind. And there are many different sources of data on health and health policy. In the United States, and I'm sure in other countries as well. So, and the data sources are collected for different purposes and by different entities. So for instance, we have population surveys, typically collected by government agencies, and there's many purposes for that, say policy analysis, benchmarking, monitoring, etc. We also have electronic health records, which are collected by the provider or the health systems that are meant for the care, provision, and coordination of healthcare. And we have claims by the insurers for reimbursements, and et cetera, et cetera, et cetera. So there's a big opportunity to combine data sources, but this has to be done carefully. And it's important to keep in mind the quality of each source with respect to its intended use. But why do we want to combine these different sources? So some people are saying they can't hear. Is this a common problem, or I'm seeing in the chat that some people can't hear.
I'm okay. Any other colleagues have?
Okay, well, then I'll continue. So here are some reasons to combine data sources, and these, of course, are not the only reasons, but these are some of the reasons we discuss in our paper. So you may want to improve representativeness. So for instance, in sample surveys, even in probability surveys, because you have non-response and undercoverage, you might have biases. This of course, is something that we want to try to correct. And in non-probability samples, we have an unknown selection mechanisms. So we have some, we can have some bias as well based on that. So this is one reason. And then another reason might be to examine generalizability and transportability of health policy interventions. So what does that mean? Generalizability means that whether the results apply to the broader population beyond the sample. And transportability refers to results from a study in one population also apply to other populations. And you can use similar techniques to the ones we discussed here for these purposes, but I'm not going to go into detail into these topics here, so I put some references. And then another reason, and this is one of my favorites, is to produce accurate granular estimates. So sometimes you want estimates for small geographic groups, or for detailed demographic groups, or for other subgroups of the population. And sometimes survey data alone may not suffice. And in fact, sometimes no data source alone can suffice. So then we want to combine different data sources. And we'll talk a lot about this one. And another reason can be to expand the number of variables in a data set. And of course, this is extremely useful for modeling because sometimes the variables that you want are in different data sets. And so you want to be able to combine them in such a way that you can have access to more covariates. So anytime we combine data sources, we want to consider the data of the quality, the data quality of the sources being combined, and in particular, the strength and weakness with respect to the analytical goals. So this is what we're going to talk about next. So what is data quality? It's the degree to which data capture useful and trustworthy information for an intended analytic purpose. And this definition comes from the Federal Committee on Statistical Methodology. And there are other data quality frameworks. But we'll just, with this, we focus on this one, which is a very useful one. So in the FCSM data quality framework and other data quality frameworks provides a common vocabulary for describing the quality of data and their fitness for use for statistical purposes. So these are the elements of the FCSM data quality framework. So we have utility, objectivity, and integrity. So utility includes things like relevance, accessibility, timeliness, punctuality, granularity. Objectivity is things like accuracy and reliability and coherence, and integrity, things like scientific integrity, credibility, computer and physical security, and confidentiality. And so this FCSM effort came about because of the federal statistical system's keen need and interest in combining data sources rather than just focusing on surveys. And there is a very high cost of data collection, and there's declining response rates across the world. So there's many reasons to want to combine information. So we will illustrate this data quality framework with some examples to make it more clear. So here's the first example. So there were two data sources collected by Statistics Canada using this paper by Bamariu and Schnitzer in an analysis of Canadians' trust in elected officials, health authorities, and others shortly after the start of the COVID-19 pandemic. So one data source is the labor force survey. This is a probability survey whose target population is composed of non-institutionalized persons aged 15 years and older. And then the other one is impacts of COVID-19 on Canadians, a crowdsourced web-based data collection. And this is a non-probability sample. And by the way, we will define non-probability samples later to be more clear, but the point with the non-probability sample is that it was collected in such a way that we don't know if it's representative of the population, we don't know the selection mechanism. So the labor force survey has high objectivity and integrity because it's based on a known sampling frame and because it's administered by a federal agency, and this lends credibility. On the other hand, this like non-probability sample had high utility because it actually had the measures of interest related to trust, and it had timely real-time measures of COVID-19 impacts. However, the objectivity or scientific integrity of this data source by itself is unclear because of the non-probability sample. Possibly bias can result if not adjusted by combining it with other data sources. So in this example, you can see, going back to the graphic we saw earlier, the web source has a lot of utility, and it mostly has integrity in the sense that of computer and physical security, confidentiality, and the fact that it's affiliated with Statistics Canada, but it's unclear its scientific integrity and credibility and accuracy and reliability and coherence. On the other hand, the Canadian Labor Force Surveys has accessibility, timeliness, punctuality, and granularity. It has accuracy and reliability and coherence, and it has integrity, but it doesn't have the questions that we're interested in. So what the authors did in this case is something very similar to the techniques that we're going to discuss later. So an important takeaway is that it's important to understand the strengths and weaknesses of a given data source and incorporate this into our statistical analysis. Let's give another example. So this example relates to the poor objectivity of an administrative data source for the intended data use. And this is pure accuracy and reliability. So something that we're very interested in the United States and elsewhere is social determinants of health. These are the non-medical conditions of people's lives that impact overall health. For instance, housing, food security, air quality. According to the World Health Organization, social determinants of health account for up to 55% of an individual's health outcomes. So it's extremely important to understand social determinants of health and how they may affect specific health outcomes. Medicare is a federal health insurance program in the United States that provides coverage primarily for individuals aged 65 and older, as well as for some younger people with disabilities and certain chronic conditions. And as of the mid-2010s, this could be recorded by providers if they discuss it with patients in Medicare records. But what is the problem? The problem is that the percentage of providers that did that was very low, and so this is actually the percentage of Medicare beneficiaries with documented C codes for social determinants of health. And these are two types of coverage in Medicare. And as you can see, it's extremely low. So that's why the accuracy and reliability of this source to study social determinants of health is very unclear. I mean, Medicare is actually an extremely useful data source to study a number of things, but for this particular purpose, its accuracy, its objectivity is not clear. On the other hand, there is something called the Medicare Current Beneficiary Survey, and this is a longitudinal survey of a nationally represented sample of the Medicare population in the United States. And the percentage of beneficiaries reporting social determinants of health is much higher. So this has good relevance, accuracy, and scientific integrity for understanding social determinants of health. And it measures other things as well. A third example is one that we'll talk about a lot later. And so this one is about granularity. So in this project, we were interested in understanding hearing loss in the United States by race and ethnicity, gender, and age at the county level. And this is extremely important because it can help prioritize areas to target for raising awareness. It can help allocate resources for prevention and treatment, and it can shed light on health disparities. But the challenge was that no single data source alone has a large enough sample size or is accurate enough to estimate hearing loss for US counties by groups defined by age, sex, and race and ethnicity. Some sources were rather large, but didn't have a very good measurement of hearing loss, and others were too small for accurate estimation. So we combined these different sources. And I'll talk a lot more about this example later because it's a really interesting example. So now I'm going to talk a little bit about blending probability and non-probability samples. But before I do that, I would like to define a probability sample and a non-probability sample, so we know what we're talking about. So in a probability sample, there is a known positive inclusion probability for every unit in the population of interest. So you'd have to have a frame with complete coverage for this to hold. And probability samples are typically sample surveys or censuses, which are a special case. So the truth is that in practice, even a well-designed and well-conducted survey will not meet this criteria because of there's under coverage and potentially differential non-response. But surveys that want to be representative usually take a lot of measures to mitigate this kind of error by non-response follow-up and then adjustment. So these are our probability samples. And then our non-probability samples have unknown sampling frames, unknown selection mechanisms, and unknown probabilities of participations. And in fact, some of the participation probabilities may be zero because there may be parts of the population that could not be reached. Like for instance, if you're doing a web survey, some people may not have access to that. So usually they are not representative of the population of interest. And these include things like opt-in surveys, social media data, etc. So typically they have differential participation, which basically means that different groups might participate in different rates in a way that we don't understand without any other information. So this differential participation can lead to bias as can under coverage and differential non-response for probability samples. So, but a lot of these problems can be addressed by combining data sources. So next, I'm going to talk about 3 methods of combining probability and non-probability samples via weighing. And I'm going to motivate them with an application to illustrate them. Again, another interesting application. So namely, I'm going to talk about inverse propensity weighing, dual frame estimators, and calibration. So the motivating example is a survey called the National Hospital Care Survey by the National Center for Health Statistics. So this is a stratified simple random sample of in-scope and eligible hospitals, and responding hospitals provide encounter data. And the survey includes things like demographics, diagnosis, length of stay, discharge status, and this is a probability sample. So, what's the problem with this? Well, the response rate in this survey was rather low in this year. It was 33.7%. And there was also a need for granularity that was not quite supported by the sample size. And there was an issue of data confidentiality, which I will discuss in more detail later. So here, I'm going to define just some notation. So suppose SA is the probability sample from NHCS. And then, by the way, it's SA because we'll call it sample A, and there will be a sample B that we're going to use to address some of the issues we talked about. And this is the survey variable, and this is the design weight. DK is the design weight. Pi Ka is the inclusion probability, and Xk are the characteristics, like other characteristics that may be in the survey. So we can write our Horvitz-Thompson estimator using the inverse of the inclusion probability to weigh the Yk. And here we define the notation IKA, which is an indicator of being in the sample. So we'll come back to this notation, so I wanted you to be aware of it. So with large sample sizes and complete response, the Horvitz-Thompson estimator would be an accurate and unbiased estimate of the population total of interest. But as mentioned earlier, we have non-response and the desire for granular estimates. So we're going to combine this survey with other sources. So here are sources that we're going to use. So again, we have the probability sample here. We'll have a non-probability sample of proprietary encounter information, which includes YK and XK. And we will have something called the Healthcare Cost and Utilization Project, provided census level information about some characteristics that are in common with these two for hospitals in the universe. To summarize, so the National Hospital Care Survey, we have survey data, we have known frame and non-frame, known probabilities of selections. It does have non-response. For the proprietary hospital data, it's a non-probability sample. It was from 2020 and provided patient encounter data for another set of participating hospitals. And again, because it's a non-probability sample, there's a non-participation, there's an unknown participation mechanisms with an unknown frames. And lastly, we have HCAP, which provides comprehensive information on hospital care in the United States. And from HCAP, the authors obtain census information about the hospital. So that's just to remind you of our data sources, so for you to keep that in mind. So now I'm going to give you a preview of what steps were done to improve the estimates here. And then I'll go into a little more detail. So step one was to adjust the survey weights for the non-probability survey to address the differential non-response. So for that, we use HCAP, which is like the census data source. And the approach was inverse propensity weighing. And I will explain this later, what this means. And the weights are recalculated by modeling the propensity to respond. So that's the idea with propensity weighing. It's like we want to model the propensity to respond. So that was steps one. So we adjusted the NHCS for non-response using the census data. Step two was to adjust the non-probability sample to address differential participation. So this is so we can obtain an approximately unbiased estimate based on the non-probability sample, but we're using HCAP kind of to ground this probability sample in a real population. And here we use inverse propensity weighing once again, where the idea now is to estimate the propensity to participate or participation probability for the non-probability sample. So it's another way of kind of reweighing the observations to make it better reflect the population of interest. And step three was to combine the two above. And so basically we wanted estimates that were based on both NHCS and the non-probability sample. And for this, we use something called dual frame estimation, which I'll talk about later. And there was a fourth step that is not related to coming up with better estimates, but there was a second objective, and it was to be able to produce a restricted use data file that included none of the proprietary non-probability sample information with greater accuracy than the NHCS data alone. So they wanted to release some data, but they didn't have permission to release detailed microdata from the proprietary non-probability sample. So what they did is use calibration. And calibration is a common practice in surveys because of the potential for reducing undercoverage bias and improving precision. And it was used, so it was used here for this purpose, to produce this restricted use data file, which was calibrated to these estimates that you use both NHCS and the non-probability sample, so they were more accurate. So I'll talk a little bit more about calibration, but essentially what it does is simply ensure that the weighted estimates from the NHCS sample only agreed with a vector of key national estimates from the combined data. So this is to give you a preview because this is a multi-step kind of project, and so I wanted to kind of give you a preview. Now, I'm not going to talk about step one in particular because the idea is the same as step two. So I'm gonna talk about step two now. So step two is involves the calculation of participation weights for the non-probability sample. So now B refers to the non-probability sample. And as we discussed, we don't know the sample frame, and we don't know the probabilities of participations, and we don't know the weights. So the solution is to estimate the probability of participation. And so we use the non-probability sample and the census serves as a reference sample. And by the way, you don't need to have a census as your reference sample, but you do need to have a probability sample. So and then you can use kind of pseudo weighing techniques. So the reference sample must represent the full target population. So like I said, it doesn't have to be a census, like in this case it was, but a probability sample would represent the target populations. And it must include some variables in common with the non-probability survey and some that you think are relevant to understanding the model. So the idea is to combine the non-probability sample and the census data as follows. So IKB is now an indicator of selection into the non-probability sample. So we model this IKB as Bernoulli, and then we use kind of a logistic regression here. I mean, there are other alternatives as well. And you can fit the model then and obtain kind of an estimate for PyKB. And so you have, you can obtain this inverse propensity weight, which is 1 over the participation probability. And then you can compute a weighted, basically Horace-Thompson-like estimator of the total using this new weight. And what this does is kind of reweigh the population to now reflect, reweigh the sample to now reflect the population more accurately. And this estimator is approximately unbiased under the correct propensity model specification. So again, like I did not go over on how we would correct NHCS, the NHCS sample for non-response using HCAP, but the idea is exactly the same, but instead of modeling the propensity to participate in the non-probability sample, we model the probability to respond to the probability sample. So the idea is the same. And here's a reference, and there's a few more in our paper about pseudo weighting approaches. And this is a rapidly growing field, and there's a lot of different pseudo weighting approaches, but this is the general idea. Next, they wanted to combine, and this work, by the way, was done by my collaborator Jay Bright and some of his colleagues. So next, they wanted to combine the information from both the non-probability, now adjusted, and the probability sample, also adjusted for non-response. So they used kind of ideas coming from dual frame estimation, and I'm going to tell you a little bit about what these ideas are, and then I tell you how they applied it. So in a dual frame estimation setting, you have two frames, A and B, and so you can think of it as kind of like two circles and which have an overlap, right? So you have A and B, A and not B, and B and not A. And so what is done in what we call a separate estimator is we basically come up with an estimator for A and not B and for B and not A from the respective samples. And then you have a composite estimator for the overlap with a compositing parameter between 0 and 1. So it's like a convex combination. So this allows us to adjust the design weights for multiplicity across frames, because the issue is that if you have overlap, then some units may be more than one frame, and this is what you want to kind of adjust for. This is what we call the separate estimator, and our article also talks about other types of dual frame estimators like combined and multiplicity estimators. And in general, dual frame estimators can be used for reducing undercoverage bias to improve precision and for cost effectiveness, because sometimes there's one frame that's really expensive to sample from, so you supplement it with another frame that is less expensive to sample from. So in the case of combining probability and non-probability sample, it can be used after computing the participation propensities and corresponding weight. And if you want a more complete review of dual frame estimation, then see McCarthy and Singh, for example. Now, in the National Hospital Care Survey example, frames A and B were assumed to have full coverage. Of course, you don't know that for sure for the non-probability sample, but they did several analyses to suggest that no significant group seemed to be left out. So in fact, using this separate estimator amounted to just doing a convex combination of the two estimates from the A and B, and they chose lambda equals 0.5. So basically it turned out to be an average of the two, and the weights can be adjusted accordingly. So to summarize this particular example, we had the survey data, we had the census data here, the non-probability survey here. So what we did is this one, the census data was used for adjusting the non-response in the National Hospital Care Survey. And it was also used for adjusting for differential participation for the non-probability survey. So it was adjusted for non-response to the probability survey, adjusted for participation for the non-probability survey. And once those two were adjusted, the estimates were combined via dual frame estimation. And so so the weights can be kind of derived from this process in a straightforward manner. So this was the estimation strategy. But there was one more step in this project, as I told you before. So the National Center for Health Statistics wanted a restricted use data file that did not include data from the proprietary datasets. They did not have permission to include data from the proprietary dataset. So what they did is to use calibration to improve the precision and to reduce the undercoverage bias. Well, I mean, this is typically used for this, right? In this case, I used it to improve from the NHCS only data by calibrating it to those new estimates we came up with, combining the probability and non-probability sample with HCAP. So calibration allowed the agency to obtain weights for the NHCS only data, matching population totals from the dual frame estimators based on combining reweighted NHCS plus the proprietary database. So the general idea with calibration, in case you're not familiar with it, is to adjust the original weight so totals will match those from a larger sample or census, while constraining the weights to be as close as possible to the original values. And the classic paper on this is Deville and Sarndal, but there's also a nice introduction in Lohr's kind of also like very commonly read textbook on survey sampling and survey statistics. Okay, so now we're going to move to another topic, my favorite topic, which is Mueller estimation. What is Mueller estimation? So the goal is obtaining granular disaggregated statistics from surveys. So one example that we'll talk about in length is hearing loss for counties by age, race and ethnicity, and gender. So the problem is that even for very large surveys often cannot accurately estimate all the quantities of interest to traditional direct methods due to limited sample sizes. So, I mean, there's many very important quantities that are best measured by surveys. But the problem is that even for super large surveys, like we have a survey in the US called the American Community Survey that has 3.5 million address sampled per year. And though that's a huge sample, it's not enough for all the levels of granularity that we want. So for instance, the SAPI program that Haoyi mentioned earlier produces estimates of poverty for different age groups and at levels such as the county level or the school district level, which are very, very small levels. And it uses smaller estimation for that. So, well, what is smaller estimation? Is basically comprises modeling techniques that incorporate additional information, say from administrative records, from other surveys, using estimates from other years, etc. I'll talk more about that. And we use the word borrow strength across domains. So it borrows strength by exploiting common relationships across the different domains and between the domains and the auxiliary information. And this allows to produce accurate disaggregated statistics, including for domain with limited or no sample size. And there's many applications for this. You could use it for disease mapping, poverty mapping, unemployment, insurance, anything that's at granular levels. And so pretty much anything for which you have survey data and you want kind of more granular estimates that the survey data can afford, and you can identify auxiliary information. And there are many options for auxiliary information, and we'll talk about that later. So to be clear, on moving forward, let's just make sure we define the terms that we're using. So a direct estimator uses survey data from the domain of interest alone. And this includes our traditional survey estimators. So for instance, we already looked at the Horwitz-Thompson, Hayek, etc. And the problem, though, is that for domains with small sample sizes, it can be really unstable. In fact, you can get some really absurd estimates because of small sample size. Like you could get like zero poverty in a region that has lots of poverty or things like that because the sample sizes are just too small and in some cases you may end up with no sample size for some domain that you were interested in. What is a small area? The definition of a small area is a domain where the sample size is too small to support accurate direct estimation. So the domain might be a geographic or demographic subset of the population or both, like the hearing loss example. But just be aware that it doesn't have to be related to people or places. So for instance, for business surveys, it can be like industry, ownership type, size, etc. So it's not necessarily have to refer to people. So in a nutshell, SAE focuses on producing disaggregated granular statistics beyond what traditional direct survey methods can support by incorporating additional information from other sources via modeling. And so this is what we call the auxiliary information that we'll talk about. And some might wonder, it's like, well, if I want more granular estimates, why not just get more survey data? Well, typically, collecting enough survey data to meet estimation goals that are at granular levels would be cost prohibitive if using only traditional direct estimates. So using smaller estimation strategies would be more realistic, more feasible. So going back to the FCSM data quality framework, this goes to granularity, accuracy, but it can also address timeliness. So for instance, for that survey I mentioned earlier, the American Community Survey, for small domains, sometimes they publish direct estimates based on 5 years of data collection. But obviously, estimates based on 5 years of data collections are not as timely as those based on 1 year because kind of there's averaging what happened over 5 years. So there's a timeliness factor. So anyway, so we talked a lot about sources of additional information. So what are some sources? So we have administrative records. So we talked about Medicare, which is like a medical insurance program. And even though for that particular purpose, it was not very useful for social determinants of health. For other purposes, it's extremely useful. Then we have tax records and social security, number of doctors. There's many other administrative records or registries. A lot of data is collected for various purposes. So we can use previous vintages of surveys for surveys repeated over time. And this doesn't mean that you're pulling data like I just mentioned. You can have models that use many years, but they're basically borrowing strength from the previous years rather than just pulling different years. So you can do models that know that this year is the one you're interested in, or the most recent one, or whichever one it is. And some of these models can also better capture changes over time. In the United States, we have lots of different surveys for lots of different purposes. So you can borrow strengths from other surveys. And I have some papers that talk about in which situations you are likely to get benefits from doing that. And it's usually when you are borrowing strengths from a larger survey rather than a smaller survey that you get benefits. You can use spatial information. So if you know certain, say, provinces are next to other provinces, perhaps you believe that they're likely to have some similarities with respect to the variable of interest. And you can have commercial data, satellite data, cell phone data, non-probability samples, and geospatial data. And so the covariance, you can of course use a combination of this. So you have to still be careful with the quality in the sense that in order for a covariate to be good, it doesn't have to have full coverage of the population, but it does have to be consistently defined across the domains that you're interested in. So there's actually, I forgot to include it here, but there's a book chapter where I talk about what to look for in auxiliary information when you're going to use it for smaller estimation. So if you're interested in that, contact me later and I'll send you a reference. And I may have cited it I think I did cite it in the paper. So here's an example from an internal project at NORC. This is based on a project with my colleague Angelo Kotsubo. And so we wanted to estimate anemia prevalence for children 0 to 5 years old in Peruvian provinces. And this was based on the Demographic and Health Survey, DHS, using data from 17 to 19 for province level. So we computed the direct estimates, and many had very high variability. And under the suppression rules of the National Statistics Office of Peru, estimates with coefficients of variation greater than 15 get suppressed. And this happened a lot in this data set. So instead, we developed an SAE model that borrows strengths from administrative records, census data, and spatial information. And the spatial information was adjacencies. So which province is next to which other province. And there were kind of, the covariates we had is like there were some children with anemia based on registries. There were household characteristics associated with poverty, etc. And this is a map that I like to show because it's a good visualization. So I often show this map in introductions to SAE. So on the one hand, you have the direct estimates. And on the other hand, you have the small area estimates. And the SAE estimates generally have lower CVs and almost no suppressions. So what's interesting about these two graphs is the gray areas here. So the gray areas are parts that had to be suppressed because they didn't meet the quality threshold set by the National Statistical Office. And you see there are almost no gray areas here. And generally, it also reduced the coefficients of variation throughout the smaller estimation modeling. But it's important to remember when we look at these gray areas of the implications of these gray areas. These are actual children with anemia that live in these gray areas, which will be left behind if we don't use direct estimates. And we estimated there were about 33,000 children in these suppressed areas. So when properly implemented with good auxiliary information, SIE can decrease measures of uncertainties relative to the direct estimators, such as mean squared errors, standard errors, or CVs, and allow more estimates to pass quality thresholds, and hence release more granular estimates. And you can produce estimates for areas with no survey sample, but with some caveats, um, well, it's kind of like a missing data situation in the sense that it's very hard to verify the model assumptions if you have no sample. Sometimes you have some external sources of information that can give you like an idea if your model is giving kind of accurate answers. So you have to have some caveats about areas with no survey samples, but sometimes you do need estimates and you don't have sample, and smaller estimation provides a very educated guess, if you want to call it that. And in a sense, it could provide a degree of confidentiality protection. So that's kind of a give and take, because on the one hand, the fact of just producing granular estimate has some confidentiality risk, but by using lots of different information, it can be better than just using like a survey domain that had 3 observations. So in that sense, it has some confidentiality protections. Of course, it's a complicated issue. So who uses SAE? So I wanted to bring this up because I've been I traveled in different countries in different parts of the world, and I noticed that some countries believe that SAE is kind of experimental or it's new, but the fact is that SAE has been used in the United States for decades in official statistics. So things which are as important as poverty estimation, health insurance coverage, unemployment, and then it's here's for cancer measures and substance use and mental health outcomes. So these are all related to either healthcare or national or social determinants of health, and these are all official government agencies, and these are the official poverty estimates, etc., official estimation for unemployment. So in fact, SAE is also used in many other countries, and by organizations like the UN and the World Bank. There's a vast literature that is quickly expanding, and there is a growing demand for SAE around the world. Here's some quotes. If you don't know, the United Nations has an SAE toolkit, which Haoi had a huge part in, and I find it very useful. And so I encourage you to take a look. All you have to do is Google United Nations SAE toolkit. You should find it. So, but there you can see that this comes from the fundamental principles of statistics by the UN, that SDG indicators should be disaggregated where relevant by income, sex, age, race and ethnicity, migratory status, disability, and geographic location. So anyway, there is an important need to disaggregate, and there are similar statements by President Biden, by the World Health Organization, and the CDC talks about the importance of maps. So I'm not going to read all this, but you should be aware that it's a very growing topic. So we need SAE because our problems require detailed information, because we need granular disaggregated statistics to understand inequities and disparities. And there's an example here based on health insurance. And we need detailed information for effective data-driven local policy and interventions. And I'm going to talk about the hearing loss work later. And it's important for the allocation of resources. So the poverty estimates for children used by SAPI are used to allocate money to the children who need it the most. And it can help identify vulnerable populations, such as the uninsured and such as children with anemia. And as you will see, you can create detailed maps, which are super important visualizations. So now I'm going to go back to the hearing loss example, and I've already emphasized the importance of having detailed estimates of hearing loss in order to target interventions and understand disparities. But no single data source alone had a large enough sample size or was accurate enough to estimate hearing loss for US counties by demographic group. So these were the demographic groups of interest. So this is a study that I did with my colleague, David Ryan, who is a public health expert. And with other colleagues at NORC. So we wanted to, these were our demographic groups of interest: Black, Hispanic, white, and other. We are interested in male and female. And we wanted all these age groups because hearing loss is quite different for young people than for old people, and the prevalences are quite different in these different groups. So the geographic level was at the county level. So there are 3,143 counties in the United States. So it's a very granular level, very ambitious project. And here are data sources. So this is interesting because this survey called NHANES is called the National Health and Nutrition Examination Survey. And this has measurements taken by trained technicians. So in that sense, it's very accurate, right? It has scientific integrity in that respect, because because if someone asks if you have hearing loss, you may answer, but you perhaps don't know if you have hearing loss, unless it's very severe. So the thing with NHANES, though, is that the sample size is about 5,000 individuals per year. And there's this other data source that I already talked about a lot, because it's extremely useful because of its size. It's the American Community Survey. This one has 3.5 million addresses sampled each year. So it's much more granular. I mean, you can get much more granular estimates. But hearing loss is self-reported. So they ask someone in the household about the people in their household. So, do you have hearing loss? Do the other people members in the household have hearing loss? So obviously this is subject to error, because most people are not medical professions and cannot go and measure hearing loss for all persons in the household. And other sources of that we combine are Medicare, other administrative records, etc. And so, for instance, we had the Medicare diagnosed hearing loss, which in this case, it is very complete because it's required for payment. So then we have the number of disabled workers who work in certain industries that have high noise exposure, medium home values, and physicians per capita, etc. So these were some of the predictors. So NHANES objects, going back to the FCSM data quality framework, NHANES strength is its objectivity and integrity, whereas ACS offers more granularity, which goes to utility. So the actual methods were kind of complex, so I'm not going to go into it, but I will give a little taste of what smaller estimation models look like. But the point is that you can come up with this beautiful, well, it's not beautiful because it's hearing loss, so it's not, but it's quite a great visualization and very detailed maps. And this just shows any hearing loss by county. But the interesting thing is that you can get maps for 2 levels of hearing loss, because one of the other interesting features of the NHANES is that because you have medical professionals, you can have different levels of hearing loss, which you can't get from ACS. So we were able to measure 2 different hearing loss. You could do more, of course, but we focus on 2 different levels of hearing loss. And we were able to create this very nice visualization. And it allows you to select severity of hearing loss, race and ethnicity, gender, etc., and the combination of these things as well. So it's a really useful tool, and for the purpose of this study, a key component was actually raising awareness with the public about this problem of hearing loss and finding hotspots. And in fact, that aspect was very successful because the work, after it was published in a public health journal and received like lots of attention from the media, it was covered by lots of newspapers and radios and broadcast stations. So that aspect of not only finding important insight from the data, but also communicating it. It's an extremely important part of using statistics for health policy research. And it was an important aspect here. And it was found that individuals in rural areas actually tend to have higher prevalences of hearing loss, even when adjusting for various factors. And if you want to check out the map, it's available here. Soundcheckmap.org is a great example of a visualization. So I'll give a brief overview of SAE modeling. I'm gonna try to keep it kind of quick because I want to get to some other topics. But you can have area level models which model the direct estimator itself based on auxiliary information, typically using also an estimator of either its sampling variance or effective sample size. And SAPI does that. So what that means is that y hat, the model input, is the actual survey estimate of the proportion of children in poverty for a state. And SAPI uses stuff like tax records and food subsidy information and census information as its covariate. But you could also do poverty at the unit level. So the unit level is just, in the case of poverty, is at the person level. Of course, it can be another unit. But an example of a model for poverty is whether a person is in poverty or not. That would be your YIJ. It could be a binary variable. And this is used a lot by the World Bank and others as a way to estimate poverty. And the auxiliary information is typically censuses and detailed registries. And each has its advantages and disadvantages. Area level models have less stringent data requirements. So you just need stuff at the area level. So that speaks for itself. Accounting for complex sampling approximately is quite straightforward in most cases. And you have that the model estimators converge to the direct estimators as the sample size increases. So what does that mean? What that means is when the sample size is really large, your model predictor is going to be very similar to your direct estimator. And why is that good? Well, when the sample size is really large, your direct estimator will be excellent. Typically, for a well-designed survey, a probability survey, typically you have a very good estimate if you have a large sample size. So you want your model to give you something similar because it's basically likely very close to the truth, the direct estimator. So you just need to emphasize you need less access to detailed unit level data to apply it, so they are often much easier to apply. On the other hand, for unit level models, you need access to the unit level data for the sample and often to covariates for all the units in the population. And some of the models can be computation intensive and incorporating the complex sampling features. And the fact that sometimes the sampling is informative is an area of research that is still developing. But they do have their advantages. First of all, if you have unit level data, you may get better results because you're exploiting more information. And one feature that is really useful is the natural aggregation. So if you do a unit level model, you're basically predicting a value for every unit in the population. So you can just aggregate any way you want, and it's just going to make sense. But if you do area level models and you have different levels of aggregations, sometimes you have to do calibrations and things like that, raking, in order to have things kind of add up nicely, like states, like counties within a state add up to the county number, etc. So let me give a brief mention of the Feijerio model. Um, and so this is a classic area level model. And, and so this is just to give you a taste of what the models look like. And so you have two levels of this model, and the model is quite simple. So what I had here is the direct estimator. Theta I is the truth. So imagine the proportion of children in poverty in a state, in the United States, say, for instance. So that could be, theta I would be the truth, y I would be direct estimator. So the first line simply says that the direct estimator has sampling error. EI is the sampling error, and is typically assumed to be normal. Zero will mean zero, and samplings vary at DI, which is assumed none. And it's assumed none for identifiability, but really this is an estimate of the sampling variance that you get from the microdata, often smoothing. So, so anyway, this is simple. It just says that the survey estimate has error. And this is what relates the truth to the covariates of interest, but obviously the covariates don't fully explain the truth, so there's like a model error. And so this is the linking model. And you assume these two are independent. And so, of course, beta and the variance of these are unknown parameters that need to be estimated. And the variance here is sigma squared b. So it shows up here, actually. So the best linear predictor of theta I when the parameters are known is this convex combination of the direct estimator and the synthetic estimator. But it's a very nice result because of how these weights work. Notice that DI was the sampling variance of y hat, and if this is really small, notice that all the way goes to the direct estimator. So this is a property we were talking about. When the sampling variance is really small, then direct estimator is really good, all the way goes to the direct estimator. But when the sample variance is large, then that's when you exploit the covariates. So this is a nice property. And a little technical note for those of you doing smaller estimation is that it can be really important to smooth the sampling variance estimate. As I mentioned, this is actually estimated from the microdata, and if you just use the direct estimator, it can be very unstable. And you can look at our book, our review paper in order to see some reference of how to do that. And models can be fit from a frequency or Bayesian perspective. So if you are frequency, you make a map, say, with the maximum likelihood of sigma squared b and beta. And if you are Bayesian, you might give them a prior distribution, possibly non-informative. And here you can see this convergence between the, so here you have the ratio of the direct and model estimators. This is the anemia example from the beginning, plotted against the sample size. So when you are in the red line, it means that the direct estimator is the same as the model estimator. And as you can see, when the sample sizes are really large, they're quite similar. But with this really bad direct estimators, is here with very small sample size, you have very poor direct estimators, and you're going to get something different. And that's good because your direct estimator is probably not very good. So again, we see this converges to the direct estimator. And this is with the standard error. And again, you have the sample size. And here you have the ratio of the direct over the spatial. And so what we notice is the ratio, and this is multiplied by 100. Apart from seeing the same convergence that we saw before, we also see that the ratio, like that this ratio is always greater than 100. So this means that your standard errors are a lot bigger for the direct estimators. So this is typical of a good small area models. And you should be aware that this is just used here as an introduction, the fake area model, and it can be useful in some cases, especially when the symmetry assumption is reasonable. But it's not always reasonable. In fact, it can give you estimates of proportions outside 0 or 1. And so there are other models that might be more appropriate in some situations. So for instance, for the hearing loss example, we use a binomial logit normal model for binary hearing loss and a continuation ratio model for the two types of hearing loss from NHANES. And we use a calibration approach that was applied to every MCMC replication to kind of reconcile the two. So anyway, if you're interested in this, please see our paper with Ryan. If you Google Ryan and Franco, you can probably find it online. It's publicly available. Franco, Ryan, and hearing loss. So anyway, there's also many other types of models. Like if you had categorical data, you might consider multinomial models. And if you want to combine various years of data, there are temporal models. For exploiting proximity relationships, there are spatial or spatial temporal models. We use this in the anemia, the spatial one in the anemia example. And for combining various surveys, you can use multivariate or measurement errors. And by the way, there are other models you can use for this and other purposes. And so people often ask me for the elements of a successful SAE program. And I don't know if I want to go into too much detail, but basically, because you need a survey that measures the quantity of interest approximately without bias, but with a limited sample size, good auxiliary information, expertise in small area, but it's also really important to have expertise in the application topic at hand. And of course, you need quality data sources, and we talked a lot about that. So there are some challenges and opportunities in SAE for public health policy standards. So it's really important to be careful about model assumptions. And normality is not always appropriate. And to see more detail on that, you should see our review paper. It's also important to keep in mind whether your model was meant to predict or to explain. So in health research, we often want to know why, we want to know the causes, why is there hearing loss in rural areas? Why is there more hearing loss in rural areas? And we were often asked that by reporters. And the answer is we don't know, because our study was not meant to ask why. And this is something to keep in mind. And there is an interesting paper by Shmueli that discusses kind of that you should be aware of the objectives of your study at the beginning of your study and in all phases of the research project. And your study should be carefully designed for your objectives, because the best predictive models are not always the best explanatory models. Of course, model validation is very important. And there are various techniques available, but more research is needed. And the ability to produce granular estimates shows a lot of promise for health disparity research. But you have to be careful there, because there are several issues that come up. So for instance, you're training a model based on data from a majority group, but you're using it to produce estimates from minority groups and differences. So you have to be careful. In fact, I have a paper that I'm working on that will talk about some of the issues you have to be aware of. So you have to be careful that your model kind of understands the nature of the data and to do a lot of model validation. So, and also we have a webinar series that's 90 minutes on small area estimation. So I encourage you to check it out. It was kind of an introduction to smaller estimation. This is in the American Statistical Association's Committee of International Relations in Statistics website. So that has more detail. But now I want to talk briefly, and I know I'm kind of running low on time, briefly about methods to, yeah, I will make
Carolina.
it, should I make it
Yeah,
quick?
let's. So we have some time for our audience to ask questions. I'm sure they
Okay, I'm
have
gonna
lots of
make
questions.
this
Yes,
really quick
thank
because
you.
I'm actually not gonna talk a lot about this anyway. But basically, the methods to expand the number of variables in a data set include record linkage, which is the process of identifying and linking records that are believed to represent the same entity. And there are two types of record linkage. So deterministics, when you have rules that might be based on, say, if you have a unique identifier, then it's really easy. But if you don't, you may have several identifiers that you use together, and you have rules like if A, B, C, and D match, then it's a match. So these are deterministic. And then you have probabilistic when you have a model that kind of estimates the probability of a match. And here's a nice visualization. So you have we have three data sets, and this is a person who works a lot on record linkage. This was given to me by one of her co-authors. So she goes by Becca, her name's Rebecca, but she can be RC. So that kind of illustrates why we need techniques for record linkage. Like how do we know this without knowing Rebecca? How do we know that these are all Rebecca's theories? And so this is like record linkage, and it's an important step for enhanced data quality. And it has been used a lot in public health, and we have some reference in the book, and it's useful for a number of other purposes. For instance, in smaller estimation, we often want to have more covariates than is in our original data source, and especially for unit-level models, we may need to do record linkage. So the reason I won't cover this a lot is because we have a good webinar on it that was very recent that you can look at in the same website. And another technique is statistical matching. And this involves combining two or more data sets, possibly observed on different entities. So that's the big difference. So the data sets would contain information on a set of common variables, but the units observed in the data sets are different. So that's kind of the difference. We are not expecting that, say, Rebecca is in both of the data sets in this case. So it can be used to produce synthetic data for micro simulations. And I have an example here that's kind of interesting about that I'll briefly mention. But here's the setup. So you have this person here, you have Y's here, you have X here, but you don't have this. And for these other people here, and they don't have to be people, of course, but you don't have this, but you have this and that. And this was used in this interesting example where there was a lottery in 2008 to apply for subsidized health insurance. So this kind of set up the opportunity for kind of a randomized controlled trial. So after 2 years after the lottery, there was study collected from both groups, those that have Medicaid and those who got the opportunity to apply to Medicare and those who weren't. But the study only covered the short-term outcomes. So what they did is use statistical matching or data fusion to basically add the long-term outcomes so that they could study, like, say, the mortality by using a second data source called the National Longitudinal Mortality Study. So this is a really interesting example of using statistical matching. So you had the original study could only do short-term outcomes, and then you use data matching to understand long-term outcomes. But the people that were in both studies were not the same. And there are some assumptions on this, but I'm not going to go over them because I'm running out of time. But it's important to keep in mind that a lot of these methods do have assumptions. So I'm going to go to the discussion now. So we leave a few minutes for questions. So we saw that there are several approaches for statistical data integration, and they offer a lot of promise for health policy evidence building and the efficient use of data. It's important to start from considerations of data quality in the context of the application. And as you saw, we need population benchmark data and a reference sample. These are important parts of all of these strategies that I mentioned. So high quality probability surveys will continue to be very important. There are privacy and confidentiality risks. So for example, when you do record linkage, necessarily, like, you're adding more variables, which makes you more vulnerable to hackers, say, right? And our paper does discuss like privacy preserving record linkage as a topic. And again, it's important to be aware that a lot of these techniques do make assumptions, so it's important to consider if the assumptions are realistic for the application at hand. And as I mentioned earlier, we have a challenge as statisticians to work on effective communications of the techniques and also the assumptions that are being made, so that the results of these methodologies can be applied more broadly. Despite these challenges, data integration techniques will continue to experience rapid growth. And this is a rapidly evolving field. There's always new work on it. So it's a very exciting area to be working in. So here's references. Now I think we can open it for questions if how you would like.
Yes, thank you so much, Carolina, for being so comprehensive and very, very easy to follow. Um, um, this is a complicated matter. You explained it in a very, very exciting, interesting, and easy to understand way. So, colleagues, let me actually unmute all of you. Meeting option. Allow mic. Okay. Yeah, you're unmuted. Thank you. If you like to raise your hand, there is one question in the Q&A, Carolina, and I have a few questions as well. So in the Q&A, it's about the software. What software do you use?
Okay. I think you can use different software. So for small area estimation, well, for small area estimation, my favorites. I mean, well, I should mention that Haoi, her UN essay toolkit has a list of actual software that can use malaria estimation, right? Packages and whatnot. Personally, I prefer I like R. I like Stan and Jags, and but sometimes I do use the packages because sometimes you have time constraints. So if you want to feed a fake Harriot model, for instance, like the one I showed, there are packages available. There are lots of packages available. Now, if you want to do like more sophisticated stuff, you may want to use, say, like for the hearing loss, like was kind of sophisticated. There we use Stan, because Stan allows you to code these complex models, and it's not that hard to use. It's not as easy as applying a package, but it's but it allows you a lot of flexibility in implementing different kinds of models. So in short, there are different software. I did test for like SAE. The most developed suite, I would say, is R. It has more packages, more capabilities. There's lots of packages. Now, when you use a package, you have to be careful. You can't immediately trust it. You might want to do some testing. But yes, there are lots of packages, and I think similar techniques can be used for some of the other topics that we covered. You can use the same kind of kind of R, Stan, JAGS, etc.
Thank you, Carolina. So we are updating the wiki platform for SAE. So there will be new development, new work, methodologies, and also practical work from countries. If we have countries here, please reach out to us if you're interested to be featured in the wiki platform, because we have a site page dedicated to national practices. Now I know it's our favorite topic. There's a Bayesian approach, whether there is a Bayesian approach, Carolina, that's
I'm
in the
sorry, what's the
chat.
question?
Bayesian, whether there's a Bayesian approach to
For
SAE.
Yes, absolutely. Yes. So that's my favorite. In fact, most of my work is Bayesian. So um, there's a Bayesian approach. Often what you do is assume non-informative or diffuse priors so that, you're, so the idea is that they don't kind of influence the results if they don't assume information. Um, so absolutely, JAGS, STAN, is very good for Bayesian techniques. There's also SAE packages that have a Bayesian approach. I mean, again, the packages are developed by individual people, so I encourage you to maybe test them before you use them. I mean, but there are certainly I have not used the packages for Bayesian that are available, but I certainly use Stan and JAGS a lot. And sometimes I've developed my own code from R, but most of the time Stan and JAGS can be very useful. And there are interfaces to Stan and JAGS in R. So so certainly, I mean, Bayesian smaller estimation is just as common as frequencies, I would say. And there's actually some great advantages of doing SAE in Bayesian from a Bayesian perspective, because it can be extremely challenging to come up with measures of uncertainty in frequencies models. Sometimes you have to use bootstraps and things like that. Whereas if you use a Bayesian perspective, and you find a way to fit it, say, via JAGS or STAN, the posterior variances are very easy to get. So in fact, my friends at ECLAC told me that they find that the Bayesian approach is much easier to teach because of this uncertainty, this ease in developing uncertainty estimates like coefficients of variation, mean squared errors, posterior variances. So in the Bayesian case, it's usually posterior variances that you report.
Thank you, Carolina. There's another question on the use of machine learning and deep learning for models and validate. So we're working with Python and also David Newhouse from the World Bank on the geospatial. So integrates SAE, geospatial, and data imagery and household survey data. And there is discussion on machine learning models, whether it's actually better or worse. Then can you comment on that as well? It's in the chat.
Yeah, so commenting on machine learning techniques for SAE, what I would say is that, of course, there is potential of using machine learning for SAE, but what I see a lot of is kind of black box approaches where they're not clear about what assumptions they're doing. And that I kind of discourage strongly. I see a lot of that. I think machine learning approaches are okay and can be good when you're able to understand the statistical properties of the resulting estimators, which in machine learning you often it can be hard to do. I don't know which specific ones you're working on, Kaoyu, but my general philosophy is that, of course, you should try to exploit the latest, hot topics like machine learning. But we have to be careful because if you don't understand the statistical properties, if you can't evaluate them, and if you cannot come up with good model validation techniques, then I kind of would discourage to use them. You use something if they're really ready to use, and beware of this kind of uh, companies that offer it and they have not been peer reviewed and they don't talk about how they do it. That being said, obviously we should exploit all the the developments in different parts of science. You should always consider them for use, and I think there are ways to use machine learning in a smart way. We've been looking a little bit at variable selection using machine learning techniques, and that's fine as long as you also have other model validation afterwards. So that's my take. One more
Thank you.
comment. Beware, because
Yeah.
sometimes when you're doing machine learning for kind of equity, you beware of bias, because
Mm.
machine learning techniques can have like racial bias. So something to be aware of as well.
Thank you, Carolina. There's a question. I think we need to do another webinar on the decision tree and integration methods. It's in the Q&A. I saw before that there's a hand from Abdul. Abdul Hanan, would you like to unmute yourself? Can you unmute yourself or no? Or you want to speak? Disable mic. No, you're Abdul Hanan doesn't have a team account. Yeah, I don't know. Can you unmute yourself or you would like to type? So Abduana had a question in the Q&A asking about
Maybe he already
training.
asked because it's the same person that had the software
Yeah, so
question.
also there's a question on I have to come back on the data integration. Are there short course for this approach for data integration? What are some of the courses would you recommend for beginners like myself? And I put SAE training course, but it's just SAE. So
Yeah, to be honest, okay, so I can address this. We have a course on SAE, and I have a one or two that I gave, but Haoi has like her website. So for training on SAE, you could go to the website, the UN SAE toolkit. I've also given a few introductory, but they are just like 90 minutes, like this one, so they're not very long. But actually, Haoi has a whole training available, right?
it's yeah, it's
It's
our collaborative effort with ECLOC, our Latin America colleagues, and UNFPA. I'm putting this. It's a free course, global training on disaggregated estimates using SAE methods in R. So this is in R, the training, and we have projects, and it's about 12 to 15 hours of videos with all the experts from SAE that go through all the steps that you could possibly think of, and including some of the national experience. I think we have Bill talked about the Census Bureau CPA program.
Yeah, and there's like a few shorter reviews. So the textbook for SAE is Rao and Molina 2015. Quite a
Mm-hmm.
long textbook. I think if you look at our paper, I put some shorter reviews because sometimes we don't have time to read the book that's very long and technical, right? So for SAE, there are lots of resources. For record linkage, you could check out the webinar I mentioned, is that we actually gave recently. It's an introduction to record
Mm.
linkage. It's a 90-minute webinar. For probability and non-probability sample, I think it's a little bit harder to find the very um, clear introduction. Maybe we need to come up with that, right? Maybe for our webinar series, so I'm in the
Yeah.
Committee on International Relations in Statistics, and we do webinars. Maybe I need to do this. We need to do that as a topic and find someone who can give a 90-minute webinar on that. I don't know of very many like webinars or training because this is such a quickly emerging field.
Yeah.
But you should, but I mean, our article has some, of course, our article is a place to start, right? Because, and it has lots of references. So our article covers lots of topics, so we can go into a lot of depth of into, like, say, combining probability and non-probability samples, but it has lots of references too in our review paper. So you could start there, maybe.
Yeah, no, that's fantastic. Now I know there's one last question, but I think that will take longer time. It's about the decision tree on linkage methods, what to use, when. Um, shall we bring it to another maybe shorter presentation or later in the year and talk about, and we can work together on the probabilistic and non-probability
Yeah, let's
the
maybe. I feel
integration.
like
We can work together on that.
there's a need there to have a webinar that is very, like, maybe a little longer than what I could cover, and explains the state of the art. It's current, it's constantly evolving, right?
Yeah, it's a
But
very
still,
new topic.
to I think we should work on that, definitely.
Yeah. And so Thomas, there is, as Carolina mentioned, there was a webinar on data linkage. It was really, really great. I loved the presentation. Uh, I will look, I will share the link to the recording. You have recordings, right?
Yeah, we have
Carolina, for that.
recordings of that. We have recordings of the small area one as well.
Yeah. So we can share that with everyone here. And then let's start discussing on the next topic we can work together, Carolina. With that, I would like to thank you so much and all the audience. Uh, you have another webinar coming up, so maybe you just want to say a couple words. I
Yes,
thought
yes, I
that
would
might
love
be
to.
very interesting as well. Yes,
Yeah, so like I said, I'm part of the Committee on International Relations in Statistics. And let me see, in fact, I can pull up the talk. So we have a very exciting webinar coming up. It's on data
I have a
privacy.
link. I'll share here.
You shared it. Okay. So
I
it's
will
on data
share.
privacy. So let me see. So let me stop sharing here maybe for now. So yeah, it's on September 25 at 12 p.m. Eastern.
I share
And
the link.
the link is in the chat. So yeah, it's very exciting. We have a person who's a fantastic speaker and has given a lot of talks on this topic of data privacy. And of course, it's an extremely important topic. We talked about it a little bit today. So I hope you're able to make it. It's free, so you just have to register. And the registration is opening. So it's called The Art of Data Privacy: An Introduction to Statistical Data Privacy and Confidentiality, September 25, 2024 at 12 p.m. Eastern Time. So I encourage you to attend. It should be super interesting.
Absolutely. Thank you so much, Carolina. Thank you.